How to choose Medicare Advantage plans in 2025. If you're evaluating Medicare right now, you're probably looking at the Medicare Advantage plan path or model as an option as opposed to traditional or original Medicare. Medicare Advantage plans are now over 50% of the marketplace for new enrollees, so it's certainly surging in popularity, and it is something you should definitely evaluate. But today we're going to evaluate kind of what Medicare Advantage plans are, how to choose the right one for you, what a Medicare Advantage plans aren't, and then you've probably seen some advertisements with some celebrities on them on television or online talking about getting Medicare Advantage and getting extra benefits and things like dental and vision added to your plan and things that Medicare doesn't traditionally cover. So we're going to talk about some of those things that you can get if you are interested in them. So let's get started. Let's get your hands dirty and jump right in. Our goal today is to equip you with practical information so that you can take steps all on your own to evaluate whether or not the Medicare Advantage plan is the best plan for you personally, or if it's better for you to consider traditional Medicare plus the supplement plus the Part D drug prescription plan. One area that makes it confusing when you're trying to figure out what a Medicare Advantage plan is versus original Medicare is there's a lot of contradictory information out there on the marketplace. You'll see online comments or agencies or even videos talking about Medicare Advantage and maybe try to persuade you not to do it and to do a Medicare supplement option instead. So that makes it harder to make your decision of that sort of fear, uncertainty, and doubt that's placed in the marketplace. But Medicare Advantage plans are surging in popularity. There's really nothing to be afraid of. You do need to understand what they are and what they aren't and what their differences are between original or traditional Medicare and the private carrier takeover, which is the Medicare Advantage plan model. So let's get right to it and talk about what Medicare Advantage plans are and some of the pros and cons. Let's talk about the different types of Medicare Advantage plans. The first type is HMO. Now, this is exactly like the HMO plans that you're used to on your employer-sponsored plan pre-age 65. It's a managed care model. You have to sign up with a primary care doctor and medical group, and they contract with a corresponding hospital. In the model, though, when you have a referral to see a specialist, you have to go see that specialist inside of the medical group. Your primary care doctor will definitely refer you to a specialist inside of your group before you can see anyone outside for sure. So there is the aspect of you don't have complete control in going to see all the specialists that maybe you would want to if you want to get a bunch of second and third opinions. And that medical group and your primary care doctor and the insurance carrier will manage your care and do a lot of control of your treatment. If you're going to just a single place for all of your medical care currently, you trust your primary care doctor and medical group, and you're happy with the care and treatment you receive, this could be a great path for you. The second type of Medicare Advantage plan that you're also likely quite familiar with is the PPO plan model, which is Preferred Provider Organization. For Medicare Advantage PPO plans, you don't need a referral to see your specialist, so it's a bit more flexible that way. You're usually a little bit more out of pocket on actual medical expenses, so there's a little bit more risk there. You do receive some coverage out of network if you do visit an out-of-network provider, but you will pay more out of pocket for that. But it's also important to know that the Medicare Advantage PPO plan is still a managed care plan. It's not a pure PPO, say on an employer-sponsored or individual plan where you're controlling your treatment and there's not sort of an extensive claims review process. Your care is still being managed through the Medicare Advantage plan model on the PPO. Let's talk about preliminary steps that you need to take in evaluating how to choose a Medicare Advantage plan. It's really all about priorities. What's the biggest priority? Well, let's start with getting access to your doctors. So what's best to do is either provide us with a list of your doctors, hospitals, and medical groups, and we'll look up the plans that are accepting the ones that your doctors are contracted with, or you can do so on our website at plansforhealth.com, which is located down in the links below. Because let's face it, you could get a really cheap Medicare Advantage plan and save money on premiums, but what good is it if you can't access your doctors? Pretty well useless. The next priority to consider is medical expenses. You need to think about how you use your health plan. Do you use it infrequently and just see a doctor for an annual physical or checkup once a year? Or do you have lots of medical expenses, and do you tend to reach the plan's annual maximum out of pocket every year? Hospitals, surgeries, big bills. With Medicare Advantage PPO, a lot of times you'll see a deductible and you'll pay a coinsurance percentage up to a maximum, sometimes as high as $7,000 or $8,000. So if you have a lot of medical expenses and you tend to reach the maximum out of pocket or stop loss number on your plan, you might want to consider either an HMO plan, which will have flat copays for expenses frequently, or you might consider using the original Medicare plus supplement model, where your costs will be quite a bit more predictable. The next priority to consider in your Medicare Advantage decision-making process is prescription drugs. If you have medications that you're taking on a maintenance or monthly basis, you need to determine whether or not the Medicare Advantage plan you're evaluating covers those medications on a formulary basis, which means they're quote unquote a covered medication or considered in network. So you can do so by running a quote on our website at plansforhealth.com, or if you call or email us, we're happy to run a quote for you, collect your medications, and show you which plans do and possibly do not cover certain medications you're taking, and in some cases, if not, whether Medicare covers them at all, or if there are alternative medications you can take in their place, which might be acceptable to you. Next factor to consider is you may be doing a lot of traveling if you're retired, and your health insurance can certainly be important while you're on the road. The HMO model is not a flexible model for people who travel out of state, or if you're a snowbird and you travel back and forth between climates in different states. We would suggest you not enroll in an MA HMO plan. The PPO model will be more flexible, and in this case, you may even want to consider original Medicare and the supplement, which will cover you across the nation in any state as long as the medical provider accepts Medicare. Medicare Advantage plans use an evaluation system called star ratings, which the Center for Medicare uses as a tool to evaluate the quality overall of a plan. And it's based on surveys from all the parties involved, whether it's the members, the insurance carriers, the provider, etc. So the star rating on a plan can actually be very informative to a consumer, as it's difficult for an insurance carrier to obtain a very high star rating, which would be, say, a 4 or 5 star rating on a plan. And it can give you good insight to the overall satisfaction of the customer base that's enrolled in the plan. So as you go through all of the factors and make your decision, make sure to check the star rating, as it can be quite insightful as to how happy you might be with your plan choice for that option. The next item to consider, whether or not to choose a Medicare Advantage plan or how to choose the right one for you, are some of the extra benefits that are added to Medicare inside of those Medicare Advantage plans. So things like dental coverage, vision plan coverage, coverage for hearing and hearing aids, or even over-the-counter allowances that you might get to help you pay for some over-the-counter items. These benefits are really attractive to a lot of people because, frankly, if you're healthy and maybe you're just going to the doctor once a year for your annual physical or checkup, you are definitely still going to the dentist. And if you've reached age 65 or greater, it's very likely you have eyeglasses and you have some vision needs, or possibly some hearing needs, or maybe you're just getting some casual over-the-counter items and you want some assistance with that, and your income is fixed and isn't very high. So these extra benefits can be crucial to people, not so important to some, but for others, if they're not really using their health plan a ton, they do have these sort of routine care items and, quote unquote, extra benefits. That's enough to make a decision for them, and it makes it quite easy. At this point, you're actually ready to run a quote and dig a little deeper into some of the plan options. So what we suggest at this time is you can actually contact us if you'd like some assistance at the number listed at the banner in this video, or send us an email. We're happy to help you get started, or simply visit our website at plansforhealth.com. You can do it all by yourself. If not, a great idea is to contact a local insurance agent in your area. If you just search for Medicare Advantage plans in your local city, we certainly suggest that you seek some expert help, as the decision is complicated and extremely important.